Hi, everyone. I'm Arfa Alam from the Partnership for Public Service. And in collaboration with our wonderful partners at the Boston Consulting Group, I am very pleased to welcome you to our next Employee Engagement LinkedIn Live, brought to you by the 2021 Best Places to Work in the Federal Government Rankings, which, by the way, are being released on July 13th, 2022, but more on that in a bit. What brings us here today is disability inclusion. In the recent report titled EEO Status of Workers with Disabilities in the Federal Sector, the Equal Employment Opportunity Commission noted that there have been modest improvements in the participation of individuals with disabilities across the federal government over the last 8 years. However, the report goes on to note that there are still significant challenges around disability inclusion and accessibility within the federal government. For example, persons with disabilities were 53% more likely to involuntarily leave the federal government than persons without disabilities. So how can the federal government overcome these challenges, and what does disability inclusion look like in practice beyond the DEIA talking points? These are questions I'm hoping our amazing panel will help us answer today. I am really, truly honored to introduce our guests today. These are three individuals who are experts in their respective fields, who authentically live by the DEIA principles that we all strive to. And they also happen to be individuals with disabilities, and so can speak to this topic from a personal level. First, from our friends at BCG, we have Hillary Wool. Hillary is a principal who works in the healthcare and public sector practice at BCG, and she also leads BCG's Global Disability Network. We also have with us Rebecca Cokley. Rebecca currently works at the Ford Foundation as a program officer for the U.S. Disability Rights Program, and she's also a former 3-time presidential appointee. And finally, last but certainly not least, we have Joshua Josa, who works at USAID as an inclusive education specialist, and he's a 2022 Service to America Medals finalist. He actually just made it to the top 6 for the People's Choice Award. So please check out the partnership website for more information on how you can vote for your favorite public servant for the People's Choice Award. Welcome to our panelists, and let's get started because we have a lot to talk about. Hillary, I would love if you could get us started by just setting the context for the audience on why we're at such a critical inflection point for workplace inclusion for individuals with disabilities and why agencies should be addressing this urgently.
Absolutely. Arfa, thanks so much for kicking us off. And Josh, big congratulations. So in management consulting, we often think about the case for change. And as Arfa mentioned, we're at a really critical inflection point in terms of improving workplace inclusion for people with disabilities, both in and outside of government. So a few reasons. In the past year, the labor participation rate of people with disabilities, which has been notoriously very low, has increased by about 3 percentage points versus a little bit under 1% for non-disabled individuals. COVID-driven workplace flexibility, a huge driver there. But we risk moving backwards if organizations aren't really thoughtful about their back-to-work policies through an accessibility lens. And then furthering this, you have a high incidence of long COVID as a truly mass disabling event impacting about 20% of folks diagnosed with COVID. And so that makes it especially acute. And then lastly, we all know that we're in a historically tight labor market. And with nearly 12 million jobs open in the United States, we know this is not only imperative as a civil right, but it's also critical for our economy more broadly, right? To make sure we're including everyone possible within our workforce.
Thanks for that, Hillary. And you mentioned that this disability inclusion, it truly is a civil right. Rebecca, I know you've spoken to that a lot on your LinkedIn page, and I would love for you to expand on that a bit and also highlight what you see as the most critical challenges for the federal government moving forward with respect to disability inclusion.
Thank you so much, Arfa. Hi, my name is Rebecca Cokley. I was a 3-time presidential appointee under President Obama, and then served for a number of years as the executive director of the National Council on Disability. You know, this issue of disability as a civil right should not be a new thing, and disability as a community, as a protected group. The ADA we're approaching its 32nd birthday. It's past its midlife crisis. It's bought its convertible, and it's gone bungee jumping and has gotten a lower back tattoo. It is time that it actually be treated as a well-tenured, well-respected federal law that it is. I think many people within employment spaces still perceive accommodations as charity, not as something that they are legally required to do, and also not as a tool that will ultimately impact the effectiveness and the success of your team. I think people often, will groan when their employees express a need for an accommodation or immediately think about the impact on its budget. And that's not the right attitude to have. This is one of your employees coming to you saying that there is a tool, a resource, a piece of software, a different setup that they need to actually help them fulfill the essential functions of their job. And as an employer, you should be happy that your employee is asking for assistance. And I think that's often not the case. I think we saw with the previous administration a real attempt to drive the numbers down of people with disabilities in employment through a variety of different mechanisms. And so to see that those numbers are coming up are really important. I think when we see what works around federal employment, it starts really with creating a pipeline. I mean, there is the Workforce Recruitment Program, which is the federal government's recruitment program for people with disabilities. It's an internship program. And so it actually gets people with disabilities interested in federal service, and it works with multiple hundred colleges and universities around the country. But part of it is also keeping your staff there. And I think what we think of when we think of best practices for employees with disabilities, we want to categorize it as like some mystical unicorn that's over here, when in reality, it's the same thing that we know is important for all employees. It's good managers that know how to meet the needs of their staff and drive them to perform. It is access to supports and services that they need to thrive in the workplace. It is performance standards and a performance work plan that helps detail what they need to do and when they need to do it. And the last piece of it is, actively working to retain them, actively working to promote them. And we know that the promotion piece is not something that is actively encouraged around employees with disabilities. We don't have strong numbers in the SES or the upper echelons of the GS scale. And there continues to need to be real work there to say, if a disabled employee is my best employee, why are they not a manager? Why am I not giving them increased responsibility? Why am I not lifting them up as I would a non-disabled employee? Because the numbers tell us it's just really not happening.
So, Rebecca, I'm hearing a couple of things. One of them is that disability inclusion and disability employee engagement, best practices for those things are really just best practices for everyone. And I definitely want to come back to this point you made around the ableist mindset that exists towards the ADA and accommodations. But first, I would like to give Josh the opportunity to respond to my first question as well. I know, Josh, you have some different perspectives to offer on critical challenges the federal government is facing right now with respect to disability inclusion, and would love to hear your thoughts as well.
Thank you so much. First, I want to just say that I'm so honored to be a part of this and with colleagues who are shining a light in this space. in response to your question, I think that there's two pieces that we should talk about. There are two different categories. First, there is a need for a shift in the mindset of employees overall without disabilities, and the system and the policies that go with that needs to be shifted, because oftentimes the perception on employees with disabilities as we need to give them something for them to be able to achieve. And that then leads to the second part of the problem, which is they often think once those accommodations have been given, that's it. They've done their job. They get a check mark in that box. And Rebecca, as well as Hillary, both mentioned, and they said retention and issues with retention and others, that is, yes, so important. But this piece about the check mark and saying, hey, we've given them the accommodation and that's it, we still consistently see big issues there. And with that then comes an additional responsibility and expectation for the employee with the disability. There might be a lot of oversights because many people don't realize, for example, I will need to coordinate with the Office of Civil Rights and Diversity and communicate with them. Hey, I need an interpreter for these days, or the quality of the accommodation is not on par, and having to reach out and resolve that issue. A lot of engagement with interpreter coordinators and schedulers and prepping the interpreters prior to my meetings or any events such as this one. A lot of time is taken that is put on us as a disabled person to be able to do that they don't know about. So there are those two challenges that I still see are persistent in workforce today. Oh, right. Also, I just one more comment, if I can, just to add, I think that we also hold on a lot of the burden of educating our colleagues, consistently reminding them, hey, if you don't understand, and I have to engage with that. Many of us are happy to do that because we value our colleagues. However, it is a burden and it's exhausting. So I'd like to add that as a part of a challenge that I see.
Absolutely. I mean, accommodations, they're meant to be, as Rebecca was saying earlier, they're meant to be tools and resources for staff with disabilities to succeed. But the way the systems are set up right now, the burden on ensuring that the services are provided for the accommodation, it ends up falling on the staff with disabilities. So how do we start to shift this mindset? And especially I want to go back to the point Rebecca made earlier. How do we shift this ableist exclusionary mindset and move towards understanding and really promoting in the workplace that accommodation is a civil right that helps staff with disabilities perform their job better. It's not special treatment. And Hillary, for this question, I'd like to go to you first.
Yeah, absolutely. I think what all of you have said resonates with me so much. I'm a former high school teacher, and I often think back to my special education graduate coursework, where it was instilled in me that accommodations and modifications are just good teaching, right? And as we've been discussing in the workplace, they are just good management, and they are part of a leader toolkit, right? And how do we flip this to, and as someone who's, a leader in my firm, right, how do we flip this to ensure that we are incentivizing and elevating and recognizing not only people with disabilities who are successful in their roles, but also managers who enable and make space and pave the way and advocate for, as allies, their employees to be as great as they can be, right? And that is something culturally that is an opportunity for development, not only in government, but absolutely in the private sector as well. We really need to flip the script there. And I think part of that, again, to echo what has been said, it's about expanding perceptions of what accommodations can look like, right? When people think about the ADA, they often think about ramps. And as a part-time wheelchair user, I love a nicely graded, well-designed ramp. It just lights up my day when I see it in a new office building I've never been to before, right? But, as Rebecca and Josh alluded to, right, there's such a spectrum of different kinds of accommodations, and it needs to be part of managers' roles, right? Even if you're not well-versed in, in all of this, to have a lens of how do I understand the needs of this person I'm working with? How do I proactively work with HR, right, and others within the firm and other resources, maybe some external to the organization, to the agency, to make sure that I'm providing the most inclusive, optimal work environment possible for my team member.
Thank you, Hillary. And as you were speaking just now, I took a look at some of the comments coming in from our audience. Sharon Randall makes a great point about the fact that disabilities may change over time. Individuals may develop additional disabilities that require different accommodations. I think something related to that, and this is something we've all spoken about offline, is the fact that disabilities tend to be dynamic, right? So Hillary, you were talking about flipping the script and changing the way HR is having conversations with staff with disabilities. Rebecca, can you speak to the dynamic nature of disabilities and the need for the conversations with HR and managers and supervisors to be an ongoing one around how accommodations can change over the life cycle of a project or throughout an employee's career?
Definitely. Thank you so much. As you said, accommodations vary and because disabilities vary. And so something that might work for you at one point in time may not work. In addition to having dwarfism, I live with migraines. And when I moved to a new, more humid climate, my migraines got significantly worse. And so the conversation that I had to have with HR had to shift and instead be one that was like, okay, the accommodations that we were using before, when I was working in DC from my home, those worked. But now that I have moved to work from the office here in our current location, it's not working anymore. And so we have to figure out what the plan going forward is. And I think I want to give Josh real props on this. When he talked about the labor of disabled people having to be the educator, that's not our job. We are not paid. We do not get a stipend in our paycheck. It'd be really great if I got $25 each time I had to educate a non-disabled person about my access needs. Damn, we should get that. We need to work on a bill that will get disabled people paid for being self-narrating zoo exhibits, because that's what it feels like every time you get a new boss or you get a new team member. And, in the little person community, we call it a dwarf orientation. And we're like, I have a new coworker. I have to explain to them why they can't move my step stool. Or I have to explain to them why in this climate of let's all be green and take the stairs, I'm taking the elevator and it's not funny. It's not a joke. And that amount of labor it should be HR's job. It really is HR's job. But yet it always falls to the person with the disability, because you're like, if I don't do this, my work is going to be impacted. How I'm perceived of on my team is going to be impacted. And so I think it's one of those things where so often the onus is on the disabled person to have to expend hours of physical, emotional, and intellectual labor for what HR should be doing or an individual staff person should be doing on Google. I've had managers say to me, especially in this time of COVID, well, how do I explain to Bob's team members that Bob is able to permanently telework because of their disability when nobody else is allowed to do that? And I'm like, you just say that. Bob's accommodation requires him to permanently telework because of his disability. Well, what if they want to know more? And I looked at her and I said, have you ever thought to say, it's none of your damn business? And she looked at me with like such shock. And I was like, because it's not, you know, and there's this perception that to be a good employee, to be a team player, we have to be willing to give up confidential information to justify our legal right to the civil rights protections given by the ADA.
I really appreciate. Yes.
I'm sorry, I didn't mean to interrupt. If I could add to that, I just like to add more to Rebecca's comment because I feel like it's a perfect tie-in. I want to start with saying that if we are not intentional, if we intentionally include, that means then we will continue to include. If we unintentionally include, then we will marginalize. So how do we instill that within the system? Because it's not only putting it on the individual person as their responsibility, but just as Hillary talked about, the ADA, and it's such an envisioning nice ramps and everything like that. And I want to take that example one step then further, because we know that ramps, they are quote unquote for people who have wheelchairs. But as time went on, we've realized that actually people who bike, people who have baby strollers, people with a list of things benefit also from those ramps. So that concept is universal design. How do we take that concept and then apply it to our workplace as well? That connects to what Rebecca made comments about teleworking. People with disabilities need telework. I mean, sure, yes, but why are we giving only them with telework privileges when we know that in the pandemic, people who are LGBTQI, people who are BIPOC, and the list goes on, they are actually benefiting from working from home also. So that already says, you know, going into the office, I feel microaggressions increase and such as that. While they're at home, they don't feel those things. Why can't we design our workplaces giving people what they need in their life situation? I think that then ties to someone who made a comment within the chat saying that people with disabilities, their needs change over time. And that's exactly right. I think often we don't think about people with disabilities, not people with disabilities, but people in general in terms of their full lifespan. How are we giving youth, children, and younger people those skills that they may need later on in life when they could become disabled with a hearing loss or a vision loss or becoming fully deaf or physically disabled? Why aren't we designing society and systems to then accommodate that? And I know that's a little bit big, but I wanted to drive home that point, and Rebecca made a perfect space for me to segue to that. So thank you.
Thank you, Josh. I appreciate all of that. There's so much to unpack there. And unfortunately, we have such limited time. So I know we're definitely going to have all three of you back to continue this conversation, because these are really important learnings for all of us. And but the one thing I want to highlight from what Josh just said, and again, this is something we've all talked about offline, is the number of innovations that came about from the disabled community, right, that now benefit all of us. I think is something that we don't remember nearly as often as we should. But an important question before I move on to Hillary for best practices from the private sector. This is something that came up in the comments, and I want to make sure we spend at least 2 minutes on this. Persons with disabilities are significantly undercounted because of a lack of trust in their leadership, right? There is a fear of retaliation. There's a hesitancy to self-identify and ask for accommodations. Josh, really quick, can you give us some guidance on how agencies can create a culture of psychological safety so that staff with disability do feel safe self-identifying identifying and asking for the accommodations they need?
I think that's a great question. And that starts with how the agency then as a whole perceives people with disabilities. If it's integrated within their daily conversations and positive talk about disability and walking the walk and providing different resources like captioning on movies or alt text while pictures are up during presentations or in describing what images that they're seeing on the screen, there's accessible physical space. Also, maybe people it'll be less of a need to actually ask. I think that's one end. But then how they're talking and how they're offering opportunities for people who have disabilities to ask, that's also a big piece of this. People can express, they have a specific, if there's a specific space that they can express themselves in, that's another thing. But I think you have to respect people and their journey through their life. Not everybody is ready to accept or identify that they have a disability. Some people get disabled later on in life, or like myself, I was born disabled, so I already knew what I would need to do to navigate the system. So it's a little bit of a range there. It's diverse in everybody's experience.
Thanks, Josh. Given our limited time, Hillary, I know that BCG is doing some great work in this space, and I would love for you to speak to some best practices from the private sector that the federal government can follow on disability inclusion.
Absolutely. So a little bit of the story and some lessons learned from our efforts over the last few years launching our Accessibility Disability Staff Network, or ERG Employee Resource Group, that I think could have parallels for federal agencies and beyond. We'll acknowledge, though, like we are definitely a work in progress, standing on the shoulders of many activists, right? The folks, in the room right now, but also as Rebecca acknowledged, right, years of activism, right, from, the Judy Humans of the world and others who literally put their bodies on the lines to fight for the rights that we now have codified in our laws. And so, Arfa, as you mentioned, I was a founding leader of originally our North America Accessibility Network a few years back at the end of 2019. And admittedly, at the time, so we'd had a launch of a disability-focused community of some sort a few years prior that had actually fizzled. And something Rebecca and I had talked about in one of our prep calls was around, like, how do you even get enough people to raise their hand and openly say, like, I'm willing to bear that risk and self-identify as being part of this community? At the time, it was really just a few of us of all staff levels, consulting and support staff, thinking around, like, are enough people even going to sign up to make this worthwhile? But I personally just had conviction acquiring a disability at this firm and just seeing how many people, even within that first year, were coming to me as a very, very junior leader, just begging for help, right? And so it was definitely fuel to my fire. And, a few years later, we have expanded from that small group of a few people pre-Zoom on a conference call to a global staff network of over 500 members. And so we're focused on 4 pillars explicitly: physical disability, as well as chronic illness, mental health, and neurodiversity. So I think, one lesson is it's really important to call out, right, and to repeat again and again who is included in the definition of disability. Because many folks some folks might not want to opt in or self-identify, but there are some who might be willing to. They just have only been exposed to a narrow media-driven definition and archetype of what disability means. So I think that's one point. Our network has provided resources to people with disabilities, caregivers, allies. Some of our initiatives have included mentoring programs where more senior staff members with disabilities mentor junior folks to ensure we've got that retention, promotion pipeline. We've done presentations on reasonable accommodations in the workplace. We've developed office design accessibility guidelines. We've done all staff speaker programming and deep dive discussions like what are the best practices bi-directionally for having conversations with your manager around the accommodations and support you need. I think some other learnings we've had along the way. So it needs to be both kind of a top-down and bottoms-up effort, meaning role modeling and sponsorship at the highest level is critical. We've got managing directors and senior partners, the highest folks in our organization who are the face of this initiative. And senior leaders need to be acknowledged for stepping up despite the stigmas that leaders often face, right? As Rebecca mentioned. I think having clear policies that are well promoted matters a lot. And I think just promoting normalization, right? Just like we honor and celebrate LGBTQ Pride Month, right? We can celebrate Disability Pride Month and really just create a culture that opens it up to dialogue, right? It doesn't mean that, the dialogue won't always be weird or have points of misunderstanding, but at least putting the numbers out, right? Opening up that dialogue and creating a community, like you build it and they will come. And so I think those are just some of the points that we've learned along the way.
Thanks, Hillary. And I hope our audience will forgive us for going over for a few minutes, but I can tell from our comments, this conversation means a lot to our audience as well. So before I wrap up, Rebecca and Josh, any final thoughts you'd like to share?
This is Rebecca. The last thing I would say is that I'm talking to all the managers. We know that there are managers with disabilities. We know there are assistant secretaries with disabilities. We know there are cabinet secretaries with disabilities. You cannot expect your staff to self-identify if you refuse to. One of the number one things that we know leads to successful self-disclosure is seeing your experience reflected in leadership. And once you get over your own internalized ableism, then your staff will come along with you. But you can't expect them to be willing to stick their neck out there, to risk discriminatory treatment, to risk ableist treatment, if you're not willing to do so yourself. So really strongly recommend you do whatever you need to do to get right with yourself, to talk to your people, to talk to your family, to talk to your therapist, talk to whoever you need to talk to get you in a place where you feel like you can bring your whole self to the table. Because also, what kind of leader are you if you can't bring your whole self to the table? And so encouraging you to do the work on yourself at the same time that you're asking your staff to be willing to self-identify in order to receive and use the access tools that they need to thrive.
And just quickly, I'll add, because with the interest of time, right now we're living in internet age where things have shifted in the past 10 to 15 years. Look online. There is a wealth of information online, and you can educate yourself about everything that we're talking about today in this session. So thank you so much for being here.
Thank you to our amazing panelists. This has been an absolute privilege and honor for me. And this is just the start of the conversation. I really hope that you all will be willing to come back and continue this discussion. I want to thank our wonderful partners at the Boston Consulting Group again for helping sponsor such an important conversation. And thank you to our audience joining us virtually. And stay tuned to the Partnership LinkedIn page for more announcements around the 2021 Best Places to Work in the Federal Government rankings coming on July 13th, 2022. Thanks, everyone, and have a great day.
Thank you all.